Have you ever wondered how humanity survived deadly diseases long before modern hospitals and medicine existed? Every breakthrough, from ancient healing practices to today's medical innovations, tells us a story of curiosity, resilience, and hope. Let's take a journey of the history of medicine and discover how it transformed the way we save lives.
The history of medicine began years ago with healing and treatment of disease. It has always been a mainstay of human life. Since the earliest humans, medicine constantly evolved, shaped by technological breakthroughs, scientific discoveries, and cultural changes. We can preemptively state that humanity has only been able to evolve thanks to medicine and its ability to combat disease and illness. The earliest documents on medical practices are more than 4,000 years old, with evidence found at archaeological sites in Egypt and Mesopotamia. Aspiring physicians used plants, minerals, and other materials to treat illness and injury, often using religious rituals in their treatments. Among the earliest known medical texts are the Edwin Smith Papyrus from the 17th century BC and the Ebers Papyrus from the 16th century BC, describing multiple diseases and their treatments. The texts were found in excavations in ancient Egypt and named after the researchers. Edwin Smith was an American antiques dealer and collector, and George Ebers, a German Egyptologist and novelist. Ancient Greece had a lasting impact on the history of medicine. A Greek named Hippocrates, often known as the father of medicine, was born on the island of Kos in 460 BC. He believed that diseases had natural causes, and the physicians should understand environmental conditions and lifestyle as factors. The medical writings of Hippocrates, known as the Corpus Hippocraticum, are the bedrock of modern medicine. Among them is the world-famous Hippocratic Oath, a solemn oath that physicians traditionally take when they complete their higher medical training. This includes several promises, among them the protection of human life, the preservation of medical confidentiality, and the intention to never intentionally harm patients, and a commitment to education and continuous improvement.
Ancient Rome also had a considerable influence on the history of medicine. Galen, a Greek physician who lived in Rome, was an advocate of observation and experimentation. He performed dissections on animals and established an advanced understanding of human anatomy. His works profoundly influenced medical practice in the Western and Eastern world. In the Middle Age, medicine was often practiced by monks and priests, who commonly treated illness with prayer and religious rituals, but developments in areas such as pharmacology, surgery, and anatomy keep occurring. The Persian physician Avicenna wrote the Canon of Medicine in the 11th century, one of the most influential medical texts in history. Medical knowledge from the Middle Age was also preserved and developed by Islamic scholars who translated ancient texts and carried out research in fields such as plastic surgeries and ophthalmology. The Renaissance period renewed interest in medicine and science. Physicians such as Andreas Vesalius performed dissections on humans, finding accurate information on the human body's anatomy. William Harvey discovered blood circulation in 1628. There were also significant breakthroughs in pharmacology, discovering new drugs and chemicals to treat diseases.
The 19th century was a period of great leaps forward in medicine, with many new treatments and technologies. In 1874, Ignaz Semmelweis discovered that hand washing could prevent disease transmission, a significant breakthrough in preventing hospital infections. Louis Pasteur discovered the existence of microbes and the relationship between these organisms and pathologies, helping to lay the foundation for microbiology and immunology. Anesthesia also made it possible to perform more complex surgeries and significantly reduce the associated pain and suffering. In the 20th century, medicine underwent major transformations in many areas, including genetics, pharmacology, surgery, and medical technology. Alexander Fleming's discovery of penicillin in 1928 began a new era in the fight against infectious diseases, saving millions of lives. Imaging techniques such as computerized tomography and magnetic resonance imaging made it possible to see inside the human body, helping to diagnose diseases and injuries. Gene therapy with modification to individuals' DNA to treat genetic diseases also began to be developed in the late 20th century. In the 21st century, medicine has continued to evolve rapidly, with strides in areas such as nanotechnology, artificial intelligence, and biotechnology. New treatments for diseases such as cancer and autoimmune disease are being developed. Personalized medicine, which consider individual differences in genes, environment, and lifestyle, is increasingly common. The recent global health crisis in 2020 stressed the ongoing importance of medical research and innovation. The history of medicine is made up of discoveries, innovation, and meaningful progress that has shaped the way we treat and prevent disease. From the earliest methods in ancient times to the technological and medical breakthroughs of today, medicine has constantly evolved, saving and improving the quality of life for millions of people around the world.
These days, many diseases can be effectively alleviated or even cured by taking the appropriate medication. There are drugs available which, for example, lower blood pressure, reduce blood glucose, or treat cancer. In the USA, patients are prescribed an average of 12 different drugs a year. Those over the age of 65, as many as 28. Since all drugs can cause side effects, physicians individually weigh up the expected benefits against the possible risks for every patient. Side effects can vary greatly. They range from minor symptoms such as nausea, headaches, or skin rashes, to more serious side effects like heart rhythm disorders or liver damage. In worst cases, they can even be fatal. It is often impossible to predict whether side effects will occur. They can be caused, for example, by individual genetic factors. Interaction with other drugs or foodstuffs can also trigger side effects. Unfortunately, side effects can never be completely ruled out. Fortunately, serious side effects tend to be quite uncommon in most patients. In other words, more people benefit from a therapy than suffer from serious side effects.
In any case, patients should be aware of the benefits and potential risks before taking a drug. So always read the information leaflet to find out about possible side effects, and ask your doctor or pharmacist whenever needed. When talking to a doctor, don't forget to mention any other medicines you might be taking. You should also consider whether other diseases have occurred in your family's history, and only take drugs that have been prescribed for you personally. All approved drugs benefit from the fact that data about the wanted and unwanted effects has been evaluated. Such important data collection continues also after a drug has been introduced. This information is incorporated into the information leaflet. It helps you to understand the benefits and the risk of taking the medicine.
And again, don't forget to ask your doctor or pharmacist about the benefits and risks when a drug is prescribed to you. If you have questions, you can find information on the internet, websites of health authorities or medicine regulators in your country. The physician or pharmacist can also answer your questions. Don't be afraid to ask if you need more information.
It is important that you understand why you are taking the medicines prescribed to you, how they work, and the risk of side effects.
Now the question is, If this technology had never been invented, how would the world be different today? Without the advancements in medicine and medical technology, countless diseases would remain untreatable. Life expectancy would be much shorter, and millions of lives would be lost to illnesses that are now preventable or curable. Our world would be far less healthy, and the progress of the society itself would have been greatly limited. So as medicine continues to evolve, the real question is, what life-saving breakthrough will shape the future more?